Welcome to another episode of Eye on the Community. I'm your host, Sean Anthony. Joining me to talk about mental health awareness, because this month is Minority Mental Health Month. We do have the Chief Executive Officer of Urban Minority Alcoholism Drug Abuse Outreach Program of Franklin County, Ms. Tammy Doby, and also the CEO of Community for New Direction, Mr. John Dawson. I want to welcome both of you to Eye on the Community. How are you?
Thank you.
Well, thank you. Thank you, Sean.
Doing
Good
well.
to have you both. Listen, what unique mental health challenges or cultural stigmas around mental health do minority communities face? Mr. Dawson, I'll start with you on that question.
Okay. One unique challenge that we have is the lack of culturally competent providers. We don't have the representation in the minority workforce to meet the needs of minorities seeking mental health. And then another one that's really prevalent is minorities keep it a secret. It can be embarrassing to have a mental illness. So some of the stigma is self-attached. And then lastly, I would say there's still racism in healthcare. And so minorities don't often get the same care that Caucasian counterparts get, and sometimes unknowingly by themselves. They're just treated differently and don't come back. Tammy?
Yeah, so yeah, thanks, John. And I agree with everything John said, and I like to also add a few things. Historically, African Americans, when things are not going well, we typically go to family, friends, and most importantly, the church. And so we haven't historically sought out help from the medical perspective. And so that trust issue also is there too, of how treatment in the past have treated African Americans, like, for example, the Tuskegee experiment. So we carry a lot of trust issues, how things are, as John was saying, we're embarrassed. But another big one too is, I don't know if you guys remember when we were kids, how your parents would say, what happens in this house stays in this house. And so a lot of times we don't feel like we don't have the confidence to go outside of the home when things aren't right. And so I think all of those things make our walk a little bit harder to get the care that we need. In addition to the trust and the stigma, I think cost. I think we have a very difficult time accessing care because of money in healthcare. So it's an array of challenges that African Americans are dealing with when it comes to mental health.
You know, one other thing that we left out is specific to minority men, and I won't just say Black men, but especially Black men. We live in a society where men are powerful. We have songs that say it's a man's world, right? So mental illness is quite often viewed as a weakness. We know that it's not.
That's right.
But to communicate that and say to a minority male, it's okay to get help. Quite often we're trying to break that stigma that he's attached to himself over time.
What initiatives are your organizations undertaking to support minority mental health in the community?
We, and I've done this for years, I try to mirror our staff with our consumers. So fortunately, right now I have minority staff that matches the consumers that we have in. And so often we have minority clients say, I want a Black counselor, or I want a Mexican counselor or Hispanic counselor. And so we try to provide that wish, and it really is just a matter of, I think they can identify with me more than someone else would be able to. So that's really my initiative, is male, female. I try to always mirror what our consumer base looks like.
Excellent. Miss Tammy, I was asking, what initiatives are your organizations undertaking to support minority mental health in the community? Would you like to add to that?
Sure. So UMADAOPs across the state, there's 11 total of us. We really do focus on the drug and alcohol prevention, treatment, and recovery side. However, we do have a lot of social supports that go into the mental health regimen as far as getting people healthy. So we have peer-to-peer support here, recovery walks. A lot of our brothers and sisters who are recovering addicts, we do walks with them. You know, that support is very, very important to, you know, staying clean and being around people who are about the same thing. We do have some suicide initiatives that we're dealing with, focusing on Black boys and youth. In addition to that, we are on board with the governor's 988 suicide prevention. So a lot of it, you will find that when it comes to treatment and prevention, it goes hand in hand with mental health. John, I'm sure you will agree with that.
Yes.
That a lot of people that come in for drug and alcohol treatment also have a lot of mental health issues. So one of the things that we do is we partner with a lot of our sister agencies to make sure that they're both getting treated for both mental health and drug and alcohol addiction. And that's very important that they're treated for both, because they're not one and the same.
If someone, go ahead, Mr.
Well,
Dawson.
yeah, I actually spoke more about our staff, but I didn't speak to the agency itself. So at Community for New Direction, and we really have branded ourselves as C&D, we're a comprehensive mental health, substance use disorder treatment facility, as well as an alcohol, tobacco, other drug and violence prevention agency, with another layer of violence intervention. So we take kids from 5 years old to 14 years old and teach them the harms and dangers of alcohol, tobacco, and other drugs and violence. And then with the youth or young adults, 14 to 23, we focus on violence intervention and teaching them ways to handle life without violence. And then in our treatment facility, located at 3901 East Livingston, we see people with all diagnoses of mental health. And as Tammy mentioned, quite a few co-occurring disorders that once you've used drugs for so long, you're going to have a mental health diagnosis of some type, and we treat them all. There's not a diagnosis that we don't treat at Community for New Direction.
Now, how can individuals, they may be listening to this program right now from minority groups, advocate for their mental health needs? What suggestions would you offer?
Well, I'll take that one. You talking about from an individual, or you talking about from a group?
From an individual.
Well, one, I think we have to learn that, you know, we are not human. I know culturally we are taught to just push through things and not address them. And so we have to learn that our mental health does matter. And if things are going wrong, we have a right to say so. And those who are around us need to listen a little bit carefully so we can connect them. Because the first step really is getting a diagnosis and learning that I do have something going on that need to be attended to. But a lot of times we're pushed to say, just suck it up, move past it. You'll get past it. I dealt with it. Those are the things that we are used to hearing. but we have to change that narrative to saying, you know what, something's not right. I need to address it to get attention. So I think that's the first way to address, or as you mentioned, to advocate for yourself. It's just acknowledging that I have a problem that needs to be taken care of.
Mhm.
Yeah, I agree. I think people have to start educating themselves. You know, you can't fix what you don't know.
That's
And,
right.
and so quite often we know something's just not right, but we don't know what it is. So we have to take that first step in seeking help on identifying what it is that's going wrong with me. As Tammy said, we have to teach each other that mental health is no different than physical health.
That's right.
We're going to have bumps in the road. We're human. And so to advocate means to speak up. So if I'm getting care somewhere and I don't feel as though I'm being heard, or I don't see changes taking place that I think should be, I just have to say something.
Yes.
At C&D, we have an open door policy, and clients execute it all the time. They can go through the channels and reach my office and sit down and talk with me about what's going well, what they think is not going well.
That's right.
If it's a matter of changing counselors, we don't have a problem with doing that because we want what's best for the client.
Mhm.
So if there was a client online with us today or watching us, I would say ask for what you need.
Mhm.
As we,
That's self-care.
as we conclude, thank you for that. Ms. Tammy, can you tell us how loved ones can support someone, from minority background dealing with mental health issues?
Oh, absolutely. I think one of the things that we could advocate for our loved ones is just to listen and pay attention. If you have a loved one that's experiencing symptoms of a mental health breakdown, we need to advocate for them and get them help. We can no longer afford to sit back and say, oh, they'll get over it. This is normal, because that's really what we've done. We've normalized trauma.
Yes.
And we're not dealing with it on the scale that we should. And that's why it's showing up in the streets, it's showing up in the schools, it's showing up in places that really should be safe and free, but it's not. And so I think we have to listen a little bit more. And I think we have to encourage people to express what they feel and what they need without being hammered for what's going on and making them feel embarrassed.
I agree.
So
So we have some people out there listening right now. Mr. Dawson, how can people get in contact with your organization? And also maybe there's some entrepreneurs out there that's listening and want to help and donate to the cause. Mr. Dawson, go ahead and provide that information, please.
You can reach us at 614-252-4941. You can go on our website, which is www.cndcolumbus.org. There's a donate button, or you can walk in. We accept walk-ins on a daily basis for anyone seeking help. The address is 3901 East Livingston Avenue, 43227.
Excellent.
and the same for us too, Sean. You can reach us at 614-227-9694. And you can also access us on the web, UMADAOPFC.com.
Excellent. Well, I appreciate y'all sharing this valuable information. And listen, I just want to encourage our listeners out there, if you or you know someone that could be going through some mental health issues, take this information down, jot it, and use it. There's a lot of valuable resources in Columbus, and sometimes people just don't know about it. So with this platform, Eye on the Community, that's one of the main goals and purposes of getting this information out there. to those in the 614. Thank you, Mr. Dawson, Ms. Doby. I appreciate it.
Thank
For sharing
you,
this.
Thank
Sean.
you.
My
Thank you.
pleasure. Y'all take care.
All
Okay,
right. Have a
bye-bye.
good day.
Bye-bye.
Mhm.